Hello, class and Dr. Goldstein. My name is Lilybell Bernhardt, and I will be doing my presentation on sleep disorders. What is normal sleep? Normal sleep is categorized into repetitive cycles of sleep stages. The organization of the sleep stages has to do with the rapid eye movements and the non-rapid eye movements within each individual. Sleep is an essential part of functioning, and it assists with cognitive and motor functioning, and also mood and physiological homeostasis. It is not uncommon for those who have disruptions in their sleep to be affected in many ways. An example of this is any type of daytime functioning, such as work or school, or even taking care of children. Behavioral sleep disorders are very common in children. Behavioral insomnia of children is considered to be a very serious disorder that is brought on by a child's behaviors and has been recognized in the areas of sleep science. In this type of disorder, children have a hard time falling asleep or staying asleep during the night. Sleep disorders in early years are common for children and are usually of non-physiological etiology. Sleep disorders can affect the community as a whole. There are many issues that are brought on by sleep disorders which can reduce an individual's quality of life and therefore increase risks for medical diseases and psychiatric disorders. Most studies show that sleep disorders are very common in elementary school age children, with a rate of up to 43%. This amount of sleep is not good for an individual, and it can cause an individual to have trouble in daytime functioning, as stated earlier. The amount of sleep that an individual gets does have cultural implications and also has to do with each individual as a whole. Disruptive sleep patterns are often linked to medical conditions. There are approximately 40 million people who suffer from a sleep disorder, and another 20 million have some type of sleep-related problem. Sleep disorders usually consist of more than 70 symptoms that are categorized into insomnia, disturbed sleep, and excessive sleep. It is hard to categorize a sleeping disorder for an infant, as their sleep cycle is already so different than any other individual. In infants, sleep problems fall into the categories of sleep association type, limit setting type, or a combination of both. In sleep association type, the infant is unable to initiate sleep without a comfort item or a comfort person. In limit setting type, the issue is where the infant is sleeping and what kind of setting it is. When an infant has sleep problems, this can cause major concerns for the caregivers. During infancy, the infant will develop their sleep pattern, and this can be labeled by an increase in day and night associations, how many times they wake up during the night, and having longer periods of sleep during the night. Sleep development happens through environmental interactions and neurobiological maturation and can be associated with many things in the infant's life. Some cultures sleep with their children, causing the child to have a harder time with nighttime separation and also less nighttime wake ups, which is what the caregiver is usually looking for. Some sleep problems in infancy come from obese children. In preschool age, children's behavior and emotion issues may also contribute to the development of sleep problems. Children that are more needy, require more attention and require more parent participation for sleep, which could also be an issue, causing them to have needy temperaments, which also requires more parent participation for sleep. Approximately 25% of typically developing children that are school age and 80% of special needs children that are school age suffer from some type of sleep disorder or problem. These children usually have trouble sleeping 3 to 4 times a week, which includes but is not limited to falling asleep and bedtime resistance. These issues have been known to cause children to have functional impairment, mostly in relationship to their schoolwork and hygiene habits. In school-aged children, sleep problems reduce learning and contribute to poor psychosocial health. Unfortunately, at this age, the sleep disorder commonly has something to do with the caregiver and how they have handled the sleeping situations in the home. These children will most likely have the most conflicts in the evening when it is time to go to sleep, and also have difficulty waking up in the morning to get ready for school. Children with sleep disorders are at a higher risk than other children for social issues, psychotic issues, and medical issues. At this age, there are many extracurricular activities that compete with the child's sleep time. These include, but are not limited to, social activities, part-time jobs, sports, and an increase in demand in academic work. Sleep disorders in adolescents are also very common, but they are mostly the delayed sleep-wake phase disorder. The characteristics of this disorder are related to the internal biological clock and the social norms for adolescents. The symptoms include a prolonged sleep onset, difficult waking, and excessive daytime sleepiness. It is very common for a teenager or adolescent to go to sleep late and not wake up until the afternoon time, especially on the weekends. Obviously, this cannot happen on school days. This disorder is considered a result of behavioral and physiological factors. In all age groups, the presence of television and technology tends to have a major delaying effect in sleep cycles. An important aspect of containing sleep disorders for adolescents is that parents continue to set limits on sleep times. This helps teenagers to increase their sleep hygiene and also their total sleep time. Sleep and rest are very important elements of the activities of daily living for all individuals. Napping is considered to be a compensation for poor nighttime sleep, mostly in older adults. It is common for little babies or infants to nap, and this does not affect their nighttime sleep cycle unless they're only sleeping during the morning and not sleeping at all at night. Napping can have a negative impact on the quality and the quantity of sleep and can contribute to the cycle of poor sleep. This is often overlooked because the immediate results of napping can often be very positive. Sleep problems are still considered to be a major issue in the realm of clinical services. Cognitive behavioral interventions have significant limitations but are often and more commonly being used for nighttime fears, phobias, and anxieties in relationship to sleep disorders. In infants, interventions all focus on developing self-soothing skills in order to help children decrease their fears of nighttime. In children with inadequate sleep hygiene, the treatments mostly focus on sleep routine, psychoeducation, regulating media usage, and parental limit setting. In relationship to environmental sleep disorders, the treatments focus on psychoeducation and helping to improve sleep hygiene in children with adjustment sleep disorders. These treatments focus on the parents setting limits and the children having a support system to be able to turn to and talk to. In children with insufficient sleep syndrome, the treatments focus on getting a nighttime sleep routine, helping to improve sleep hygiene, and standardization of sleep patterns across the week as the parents continue to set their limits. In children with limit setting sleep disorder, the treatments focus on parents getting psychoeducation and desensitization to help the child to learn self-soothing behaviors. In sleep onset association disorders, the treatment focuses on cognitive behavior therapy for sleep-related anxiety. Sleeping disorders affect many Americans, ranging from infants to adults. Continuing to educate ourselves in these disorders will allow us to have a better understanding and to find treatments that actually work.